After testing positive for COVID, I quarantined for 14 days, isolated myself from my children as well.
I needed to take a test for my doctor appointment. My results came back and it said I was positive. I wasn't having any symptoms, so I wasn't aware I had COVID.
Well, first it started off with my wife and uh, daughter. They started off with COVID, and so then it wasn't until like a few days afterwards when they tested positive. I started feeling like a little bit under the weather. So then I decided to go take a PCR test down at my local clinic, and that's when I discovered, oh yeah, you tested positive, and I was like, ooh.
I first suspected that I had COVID. I got like really tired and fatigued. I kind of knew it was gonna happen because my son's grandma was sick and she ended up testing positive. I was fine up until about a week later. That's when I started feeling very tired. And I went and took a PCR test at my clinic. And I got the results, I think, actually the next day. And they had said, like, we notified Santa Clara County that, you have COVID. This is your next steps.
So I had COVID twice, me and both my children, all at the same time. The first time was around November, and then the second time was in February. I could not get out of bed for about 4 to 5 days. I was vomiting. I had a massive headache. The body aches. I couldn't keep anything down. My smell went away, and it was pretty bad.
After I tested negative for COVID, I still had like lingering symptoms like coughing and sore throat and like muscle aches.
At the beginning, it was no smell at all, no taste whatsoever. Um, I didn't really have the headache or any of the other ailments. Long haul COVID has impacted my daily life. I can't smell, I can't taste anything. I love to smell the flowers. I can't smell the flowers. Food, I enjoy food, but when you can't taste it, it's not so enjoyable.
I've never really got my sense of smell back after the first time. My appetite went down fairly a lot. I probably don't even eat maybe 2 meals in a full day. I recently found out I'm pregnant around 2 months now. So I'm not really sure if I've been putting on the proper amount of weight yet since I've had COVID and with the pregnancies. First time I had COVID in November, I ended up getting sick pay. So I was able to stay home with no worries about that. But for some reason, after 2022, when I had COVID, I think in February, I did not get COVID pay. I don't know if it was something with just my company or, statewide, but I ended up having to stay home for a few days without pay. It's really hard because, just if you don't work, then, you can't pay rent, can't pay your bills at home, can't really feed the kids. So with that, I've been having to go to food banks or talk to some caseworkers about getting help.
Due to me basically having these like the extended long-term COVID symptoms, I literally was gone out of work, I believe, for exactly a month. I got this really bad. My doctor doesn't know where I got it from, which is weird. But like I said, we have our suspicions. I got like this really bad sinus infection that led to where it was just, I was so congested in my nose. I was congested in my chest. I had this horrible cough. My throat was straining again. I honestly felt like I caught COVID for a second time.
In a sense, I was symptom free, but one thing that did linger, which was kind of weird, was a cough, like a congestion like cough that kind of just stays like right here. Like obviously you'd cough, but it feels like you have a mucus buildup right here in your chest. And it was always kind of weird. It lingered on for a bit. Whenever I go out into public places, I try to keep a mask on me so I could, so I don't, freak people out. Like, oh God, he's coughing without a mask. We do like not trying to cause widespread panic.
When I cough, people are standoffish as far as treating me differently.
you cough nowadays, people are instantly looking like, oh God, that girl got COVID, that guy got COVID. So it's like, I can't even do something simple as go like, and clear my throat without everybody going, like, giving me a dirty look.
I just take it day by day. Some smells, some days I can smell some things. Maybe a new flower that bloomed, I get a good whiff and then I can't smell it anymore, but it comes and goes. Hopefully it'll come back for good. COVID is completely real. I've lost loved ones, several of them. My husband was very ill with COVID. Take it seriously because it's affected a lot of people in a lot of different ways.
If you've had COVID recently and you find that you're getting winded, maybe don't push it so much. Don't, just try to take it easy a little bit, because you may be having some residual effects on the heart or lungs that may be causing that feeling of being fatigued or getting winded and so forth. So don't push it. Likewise, mentally, don't think that you can just go right back to how you were perhaps before the infection. Realize that this can have some lingering effects. We hear people talk about brain fog or difficulty concentrating. So maybe instead of trying to do 5 things at once, try to focus on one thing at a time and work your way back into the activities that you were doing before. It's going to be very important that if you have long COVID, that you have a primary care physician that can help to coordinate if you are going to need to see specialists. If you are going to need studies, like let's say an EKG or other screenings, neurological screenings and things like that, those are best done with your primary care provider, because it always works better to get a referral from your primary care provider to try to go to see a specialist or to go to one of these long COVID type of clinics. And the other thing I want to mention is that there are post-COVID care centers that are opening all over the nation. Almost every state has them now. There's even virtual post-COVID care centers that may be worth checking out. There are also a number of different resources and support groups. Remember that to prevent the most severe and tragic outcomes of COVID-19, vaccine and booster are still remarkably effective at preventing death and hospitalization, but now also we see in reducing the incidence and severity of long COVID as well.